Which of the following is a test for hip dysplasia in an infant? A. Faber test. B. Thomas test. C. Ortolani test. D. Ober test. The answer is C. Ortolani test. An examiner can look for hip dysplasia in an infant using the Ortolani test. This is performed by placing the child supine, then flexing the hip and knee to 90 degrees. They would then gently abduct the leg while placing downward pressure on the greater trochanter. In a healthy joint, the hip will move freely. In hip dysplasia, there will be a feeling of a clunk as the femoral head is relocated into the acetabulum. The Ober test, Thomas test, and Faber test all check for hip stability and injury in adult populations, rather than pediatric. A new mother is holding her infant just moments after delivery. After she is able to rest for a short time, she looks down and notices that her newborn is covered in fine, but fairly dark hair. This is on the infant's arms, legs, and back. She is startled and asks the nurse if this is a sign of any disorder. How should the nurse reply? A. This is abnormal, a hormone profile is required to rule out hormonal disorder. B. This is normal, it should be shed in a few days. C. This is a sign of a serious metabolic disorder. D. This may be normal, the child should be monitored. The answer is B. This is normal, it should be shed in a few days. Fine, downy hair, called lanigo, generally appears on the fetus around 5 months of gestation. It is often shed before birth, but some infants are born with this hair still intact. The hair is normally shed within the first 1 to 3 weeks of life. In most cases it is entirely normal and not a sign of hormone or metabolic disorder. A young couple presents to a clinic with a 7-year-old who has varicella, chickenpox. The child is not in any distress and the virus seems to be progressing normally. They are concerned, however, because one of them is currently pregnant with their second child. They are at 31 weeks of gestation. The carrying mother had chickenpox when she was 2 years old. They asked the nurse if they should be concerned for the health of the unborn child. Which of the following is the most appropriate response? A. There is no need for concern. B. Frequent hand washing is recommended to prevent passing of the viral load to the fetus. C. The mother should not be in contact with the 7-year-old till the last lesion is scabbed over. D. There is mild need for concern, fetal monitoring is recommended. The answer is A. There is no need for concern. As long as the carrying mother has had varicella, she will be able to pass the antibodies to the virus through the placenta to the unborn child. This will confer passive immunity to the fetus. This immunity lasts for the first few months after birth, so newborns delivered by mothers with immunity to varicella will remain immune for some time even after delivery. Increased immunity to this and other pathogens is conferred by breast milk, which contains maternal antibodies, mostly Ig. By 5 months of age, what change would be expected in an infant's weight? A. Triple. B. Increase by at least 70%. C. Increase by at least 50%. D. Double. The answer is D. Double. An infant would be expected to double its birth weight by 5 months. Some infants may double their birth weight by 3 to 4 months. An infant that has surpassed 5 months without approaching twice their birth weight may need to be evaluated for feeding difficulties or failure to thrive. At what time does molding, The elongation of the baby's head as it passes through the birth canal, resolve in a newborn? A. Less than 24 hours. B. 2 to 3 weeks. C. 10 to 14 days. D. 1 to 5 days. The answer is D. 1 to 5 days. Molding, or the elongation of the infant's head during labor and delivery, is a normal adaptation allowing the relatively large skull to traverse the narrow space of the birth canal. It generally resolves in 1 to 5 days. How long after birth should a newborn pass meconium? A. 2 to 6 hours. B. 24 hours. C. 3 to 5 days. D. 2 weeks. The answer is B. 24 hours. Meconium is a sticky, dark green to black stool that is the first stool passed by neonates after birth. It is composed of the content of the infant's digestive tract before it has begun drinking milk, primarily water, mucus, bile, lanigo, and intestinal epithelial cells. A newborn that has begun to feed on breast milk or formula should pass a normal stool, yellow to mustard green and creamy rather than sticky, within 24 hours. The nurse counsels the mother of a 2-month-old infant. Which of the following actions by the mother would be inappropriate? A. The mother makes eye contact when she speaks to the baby. B. The mother places the infant on her back during naps and at bedtime. C. The mother swaddles the child in blankets for naps. D. The mother waits 6 months before introducing infant cereals to the baby's diet. E. The mother lets her cry for 5 minutes before responding if the baby cries at night. The answer is E. The mother lets her cry for 5 minutes before responding if the baby cries at night. Infants younger than 6 months may have trouble sleeping for long periods of time because they awaken from hunger. Their stomachs are not yet large enough to hold enough nourishment to keep them asleep during the night. After 6 months, it is more appropriate to let babies cry themselves and put themselves to sleep, but before 6 months, it is not recommended. The other actions are appropriate. Infants should sleep on their backs to prevent sudden infant death syndrome, SIDS. Babies should be interacted with frequently. Breast milk is recommended exclusively for the first 6 months, and swaddling the child is important because the infant cannot sleep in loose blankets. The nurse performs triage in the emergency department for a patient with a bee sting. The family reports a history of allergic reactions to bee stings, and the patient complains of difficulty breathing and swelling in his mouth. Which of the following is the priority of the nurse? A. Contact the physician. B. Administer subcutaneous epinephrine. C. Obtain a full patient history. D. Maintain an open airway. E. Administer oral diphenhydramine. The answer is D. Maintain an open airway. Follow the ABCs of nursing priority: airway, breathing, circulation. It is most important for the nurse to maintain a patent airway, as the symptoms manifested suggest an anaphylactic reaction. Epinephrine may be given after the airway is established. Oral diphenhydramine is usually given for mild allergic reactions. The physician may be contacted later. Patient safety is the priority. The nurse is discussing end-of-life care procedures with an elderly patient who is Buddhist. The nurse knows that the patient will most likely want to incorporate A. No blood transfusions. B. No autopsy and cremation. C. Prayers to provide support and comfort. D. Time for meditation. The answer is D. Time for meditation. Buddhists will want time for meditation, and may refuse medications that alter awareness. A shrine to Buddha may be placed in the client's room. The nurse cares for an 82-year-old woman with frequent constipation. Which of the following statements by the nurse would be inappropriate? A. It could help to remove dairy products like milk and cheese from your diet. B. Make sure you are well hydrated. 6-8 glasses of water a day would be good. C. You should eat dark green vegetables and whole grains. D. You can take a laxative whenever you want to have a bowel movement. E. You can try light exercise for at least 30 minutes every day. The answer is D. You can take a laxative whenever you want to have a bowel movement. Elderly patients may suffer from bowel problems like constipation due to lower motility in the gastrointestinal tract. The nurse should advise this client to exercise daily, to increase blood flow to the GI tract, stay hydrated, to prevent hard, dry stools, eat more fiber, such as fruits, vegetables, nuts, grains, and beans, and stay away from milk and cheese, as lactose sensitivity is common and may be a cause of constipation or bloating. This patient should not take laxatives each time a bowel movement is expected. Reliance on laxatives is not recommended because it can desensitize the bowel and make constipation worse. An emergency room nurse is assessing a 26-year-old female patient who frequently uses opium. What symptoms would indicate that she is experiencing withdrawal? A. Diaphoresis, seizures, and apathy. B. Irritability, tremors, and seizures. C. Nausea, vomiting, and anxiety. D. Fatigue, disorientation, and craving. The answer is C. Nausea, vomiting, and anxiety. Anxiety, nausea, and vomiting are common symptoms of opium withdrawal. A nurse is monitoring an 18-year-old who is experiencing heroin withdrawal. What symptoms might the nurse observe? A. Seizures, tremors, and tachycardia. B. Nausea and fainting. C. Yawning, cramps, and diarrhea. D. Coma and convulsions. The answer is C. Yawning, cramps, and diarrhea. Yawning, cramps, and diarrhea are common signs of heroin withdrawal. Which of the following drugs is considered a central nervous system, CNS, depressant? A. Marijuana. B. Nalol. C. Cyclobenzaprine. D. All of these. The answer is D. All of these. All of the drugs listed are considered to be CNS depressants. While generally classified as a psychedelic, marijuana has multiple central depressant effects such as sedation and muscle relaxation. Also, alcohol is another commonly used depressant. Alcohol abuse-induced thiamine deficiency can cause which of the following? A. Wolff-Hirschhorn syndrome. B. Lewy body dementia. C. Agnosia. D. Wernicke-Korsakoff syndrome. The answer is D. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is caused by a severe deficiency in thiamine, often seen in severe alcohol dependency. It is characterized by visual disturbances, ataxia, and altered consciousness. Wolff-Hirschhorn syndrome is a genetic disorder causing developmental disability and may involve seizures. Lewy body dementia is associated with Parkinson's disease. Agnosia is a neurological disorder causing impaired ability to process sensory information. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, criteria for substance abuse includes all of the following except A. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. B. Recurrent substance use in situations in which it is physically hazardous. C. All of these are part of the DSM-5 criteria for substance abuse. D. Continued substance use despite having persistent or recurrent social or interpersonal problems caused by or exacerbated by the effects of the substance. The answer is C. All of these are part of the DSM-5 criteria for substance abuse. All of the items listed are part of the DSM-5 criteria for substance abuse. In addition, the individual's symptoms must not qualify for substance dependence, and recurrent substance-related legal problems are other DSM-5 criteria for substance abuse. A 42-year-old man presents to the ER for alcohol toxicity. While taking the history, the nurse discovers that he drinks on average 1/5 of vodka per night, and often must drink an additional 6 to 12 ounces to get a good buzz. When he doesn't drink, he experiences tremors and feels unwell until he is able to drink again. When asked if he would like to quit drinking, he states that he has tried unsuccessfully several times over his life. He knows that he needs to get control over his drinking because it is seriously impairing his relationship with his husband and their 13-year-old daughter. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this patient can be considered to have which of the following conditions? A. Substance dependency. B. Substance addiction. C. Substance abuse. D. None of these. The answer is A. Substance dependency. The symptoms described by this patient put his alcohol use in the category of substance dependency, according to the DSM-5, a more severe form of abuse than substance addiction. The criteria for this condition are: tolerance, withdrawal, unintentional excesses in consumption, persistent desire or unsuccessful efforts to reduce or control substance use. A great deal of time is spent to get, use, or recover from the substance. Interference with social life. The substance use is continued despite knowledge problems caused by use. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is B. Thiamine, B1. Prolonged alcohol abuse can result in a severe deficiency in thiamine, or vitamin B1 by reducing dietary thiamine intake, impairing gastrointestinal absorption of thiamine, and causing impaired thiamine utilization in cells. Note that individuals who partake in prolonged alcohol abuse may have various other dietary deficiencies. Prolonged alcohol abuse can result in a severe deficiency in what vitamin? A. Vitamin C. B. Thiamine, B1. C. Niacin, B3. D. Folate. The answer is A. Delirium tremens. Delirium tremens, DT, is a rapid onset of confusion seen during alcohol withdrawal. The symptoms of DT include altered mental status, autonomic instability, and even seizures. DT is also characterized by hallucinations such as the sensation of something crawling on the patient. DT is the most severe consequence of withdrawal and can be fatal if untreated. The client in the termination phase of the nurse-client relationship is being very confrontational. How should the nurse interpret this behavior? A. The patient should be admitted to the hospital. B. This behavior is common for a client in the termination phase. C. The nurse has done something to offend the client. D. The treatment should revisit the working phase. The answer is B. This behavior is common for a client in the termination phase. Confrontational behavior is very common for a client in the termination phase. The nurse should not assume that she offended the client, and further action in terms of therapy should not be addressed until completing the termination phase. The nurse is in the orientation phase of the nurse-client relationship where the client has been sexually assaulted. During this phase, the nurse should A. Explore personal ideas, stereotypes, and biases that might affect the nurse-client relationship. B. Identify themes of patterns of patient behavior and possible coping mechanisms. C. Establish acceptance, trust, and boundaries. D. Actively listen to the client express his thoughts and feelings. The answer is C. Establish acceptance, trust, and boundaries. During the orientation phase, the nurse should establish acceptance, trust, and boundaries with the client, which will be built upon in later phases. Acceptance, trust, and boundaries are established during which phase of the therapeutic nurse-client relationship? A. Orientation. B. Working. C. Pre-interaction. D. Termination. The answer is A. Orientation. Acceptance, trust, and boundaries are established in the orientation phase of therapy. Identify the disorder that presents the following signs and symptoms: numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. A. Conversion disorder. B. Bipolar disorder. C. Schizophrenia. D. Stiff person syndrome. The answer is A. Conversion disorder. Conversion disorder is typified by numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. Schizophrenia, bipolar disorder, and stiff person syndrome all have medically identifiable causes. What is the best approach towards dealing with a delirious patient? A. Frequent sedation with antipsychotics. B. Frequent sedation with benzodiazepines. C. Frequent reorientation to time, place, and name. D. Frequent 4-point restraints. The answer is A. Frequent reorientation to time, place, and name. Delirium is an organic dysfunction of the brain usually seen in sick patients post-op. These patients need frequent reorientation to name, time, and place until the delirium resolves. Agitation, confusion, and difficult to control behavior is typically controlled with antipsychotics, however, they are not first-line treatment. Restraints should be avoided at all costs. Which of the following describes the professional role of the nurse in a healthcare setting? A. Caregiver. B. Patient advocate. C. Assessment. D. All of these. The answer is D. All of these. All of these are important professional roles of the nurse in a healthcare setting. You are a new nurse taking care of a patient with congestive heart failure. You see an order to administer 500 milliliters of 0.9% normal saline over 6 hours. Later on in your shift, you realize that you mistakenly administered 2000 milliliters of 0.9% normal saline over 2 hours, and now the patient is slightly short of breath. Which of the following is the most appropriate next step? A. Do not tell anyone of the error since the patient is stable. B. Immediately inform the covering physician. C. Immediately contact your hospital's Safety Oversight Committee. D. Immediately administer furosemide to diurese the patient. E. Ask your co-nurses whether or not to inform the covering physician. The answer is B. Immediately inform the covering physician. In this case, a medical error was committed, and the most appropriate immediate course of action is to let the patient's covering physician know, so that they can determine what effect this may have on the patient, assess the patient, and determine what, if any, immediate intervention needs to be performed to ensure that the adverse effect on the patient is minimized. While it is possible in this case, given that the patient has congestive heart failure, and that they may have been fluid overloaded by the administration of excess fluids, that they will need to be diuresed with furosemide, this medication cannot be administered without the order of the covering physician, and it would be inappropriate to administer furosemide without their orders. While your hospital's Safety Oversight Committee may ultimately need to be informed of this incident, the most immediate priority is patient safety, and as such, the patient's physician should be notified of the medical error before anyone else so that they can best manage any immediate consequences of the error. It would be highly inappropriate to not inform anyone of the error, as an unintended dose of 4 fluids was administered, and this can be dangerous in a patient with congestive heart failure. Any delay, whether due to not telling anyone, or to conferring with co-nurses, and informing the supervising physician would be inappropriate and potentially dangerous to the patient.